Hello and welcome to Health Dialogue Show. I'm Dr. Bhumika, and as we observe World Cancer Day on February 4th, it's an important moment for us to reflect on the global fight against cancer and raise awareness about the same. Today's interview aims to provide a better understanding of the current treatment options available for cancer patients and how advancements in technology are shaping the future of cancer care. Joining us today is Dr. Shishir Shetty, an expert in oncology, who will also help us navigate through the diverse landscape of cancer treatments from traditional methods to cutting edge therapies. Dr. Shishir Shetty is an MBBS, MS, MCH. He completed his fellowship in robotic surgery at Emory University Hospital, USA. He's currently a senior consultant at surgical oncology at Fortis Hiranandani Hospital, Vashi, with 28 years of clinical experience. Renowned as a TEDx speaker and a Guinness World Record holder, Dr. Shetty is also a prolific author with numerous international publications. His areas of expertise include surgical oncology, robotic thoracic surgery, and gastrointestinal surgery, among others. Dr. Shetty's patient-centered approach has earned him accolades such as Abdul Kalam Excellence Award and recognition for his charitable work. With over 10,000 surgeries to his credit, Dr. Shishir Shetty is a distinguished figure who has made significant contributions to the medical field. I welcome you to the show, sir. It's a pleasure to have you on board with us today.
Thank you. Thank you for inviting me to the show.
Yes, sir. So, sir, my first question to you is, can you walk us through the main types of cancer treatment currently available?
Look, cancer is a very generic word if you look at it. We divide cancer, or rather any cancer, into two. One is the blood part of it, blood and lymphoid part of it, and second, the solid tumors. I deal with solid tumors. So when you talk about blood and lymphatic, it means leukemia, lymphoma, all the other type of cancers, which is essentially treated by chemotherapy. Here on the other side, there is something called a solid tumor. It means, say, brain cancer, breast cancer, colon cancer, lung cancer, head and neck cancers, oral cavity, stomach, soft tissue, bone, so on and so forth, uterine, cervix. So all these solid tumors, the solid organ, whenever there is a cancer, it is treated. Essentially, there are three types of cancer treatment. One is surgery, which still forms the mainstay of most of the cancer surgery treatment. Chemotherapy and radiation, these are the three traditional methods of treatment. Today, we have quite a few other things also. Today, we have, apart from this, we deal with targeted therapy, immunotherapy. Hormonal has been around for a long time. Essentially, this is, encapsulate the treatment modalities that we look for.
All right. Okay. So, how are treatment options typically determined for a cancer patient?
So as I explained you that there are solid tumors and there are other tumors like blood and lymphoma. When it comes to solid tumor, we determine first on clinical examination the staging. So I would do relevant investigations like CT scan, MRI, PET scan, sometimes to know a few things. Why I do this investigation is to know whether the disease is localized or whether the disease is localized or whether it is spread. Say I have breast cancer, I want to know whether the disease is within the breast or whether it has gone to the lymph nodes or into the lung, brain, bones, and liver sometimes. Similarly, for each organ, we do this system called as staging. Once we do the staging, we determine what is the best modality of treatment, and this is generally done in the form of a joint clinic where my medical oncology colleague and my radiation oncology colleague collectively decide what is the best modality of treatment. Today, if there is a stage 3 breast cancer or a late stage 2 breast cancer, generally we go for chemotherapy first and then decide on surgery. If the patient is a late stage 4, then it is only chemotherapy. So depending on the type and the location and the staging, we determine the treatment modality which is decided. For example, if you look at rectum cancer, then we would probably give radiation first and then do surgery. Right? If it is a testicular cancer, then we would probably look at giving only chemotherapy and surgery would be reserved last. If it is larynx cancer, if it is early larynx, we would not do surgery, we would give only radiation. So, depending upon the stage and the location of the tumor, we decide on the best modality of treatment.
Okay, that was really informative. My next question to you is immunotherapy has been a major breakthrough in cancer treatment. How does it work, and in which types of cancer has it been most successful in?
Let's look at how immunotherapy came into the market. Immunotherapy, there was an expert. I'll tell you how it works. Immunotherapy is a medicine where it will reinforce or it will activate our body's immune cells, namely the T cells, and make it active to kill the cancer cells. All right. The whole funda of immunotherapy is that. Now, please understand and note that lot of other branches of medicine, some alternative medicine people, are using this word immunotherapy in a wrong way. This has got nothing to do with immune boosters or no, it has got nothing to do with that. Immunotherapy is sometimes also called as vaccine, sometimes, but then it works when there are certain mutations in the body in which the cancer cells can be detected by activating our body cells. It does not happen in every case. The first time it was done as an experimental medicine was in the ex-president who recently died, called Jimmy Carter, who had a brain metastatic brain mets, melanoma brain mets back in somewhere in 92, or I think when he was 92 or 94. So it was started on him, and all the disease had disappeared. Because of that experimental medicine, it was fast tracked and it came and it's been used widely. If you look at lung cancer, stage 4 lung cancer, in patients who have a certain mutation, in stage 4, people who would have probably died in, say, 3 months or 6 months, now can live for 5 years or 6 years. Such is the miracle of immunotherapy. Although we cannot still use it in every case, we use it for selective cases where certain markers like PDL1, etc., is high.
All right. Okay, so next question is targeted therapies are becoming more common. So, how do these differ from traditional treatments like chemotherapy, and what scenarios are they most effective?
Immunotherapy works by activating the natural killer cells of the body, like T cells. Chemotherapy works on actively dividing cells in the body, so it is generic. So, when chemotherapy drugs attack the cancer cells because they are actively dividing, they also at the same time attack all the other areas like your mouth area, intestine area, any area which is actively dividing. So, like your hair follicles. So, the difference between this and targeted therapy is targeted is you look at the specific tumor, and on the tumor, you study the tumor and see if there are certain it is not called mutation, certain receptors which are present. Let's say GIST has something called as c-KIT receptors, Herceptin receptors in breast cancer. Now, when we have such receptors, we can use specific drugs to target that particular area in the cancer cell and destroy that. That is where the role of targeted treatment comes. It is very, very specific to the tumor. This is the three basic difference between chemotherapy, targeted, and immunotherapy.
All right, sir. So, how has personalized or precision medicine influenced cancer treatment, and what does it mean for the future of oncology care?
The whole idea why precision oncology and the study has been there for quite some time. What we do is very simple. We take the blood sample of a person and the tumor which is there in the person, and we analyze it. There are various methods of analyzing. One of the quickest methods that we have today is known as the NGS. Okay. Now, the NGS system, there are 4-5 platforms in which the NGS system works. Some of the platforms like Illumina or quite a few of them. What it does is they can selectively see the number of genes or mutations which are there in the tumor cells. You understand? So if, and it will say, look at 500 genes or 300 genes, which we have medicines for. And if there is a particular type of gene which is, say, highlighted in a particular disease, then maybe we can use a specific drug for that. That is what precision oncology is all about.
All right. My next question to you is, how are new technologies such as artificial intelligence contributing to cancer treatment development? Like, could you share any example of AI's role in diagnosing or treating cancer?
The current flavor that is happening, it has been around for quite some time. It has been successfully deployed, and I have seen the good results in diagnosing skin lesions. It has also been used and extensively being used to detect lesions which can be missed by the naked eye, like in mammographies, CT scan of the lung, some MRI. So, radiology, pathology, uh, I think there is going to be a major role of AI. There has been a talk that when we are, I'm a robotic surgeon, and the AI will keep on learning from various surgeons, because thousands of operations have been done across the more millions of operations has been done across the globe. So the AI can actually accumulate all the data and can learn as to how different types of tumor can be tackled differently. Maybe it will help us in being more precise in our surgical work. So that is the current thing which is happening. And what is surprising is, today, every day there are thousands of journals available. Now it is impossible for a single doctor to go through all of them. So AI definitely helps us in accumulating that data and giving us the latest publication. So let's say if I put breast cancer and I put stage 2A treatment, then it will probably give evidence as to what is the best modality of treatment as of now. Of course, there are various, so it will give us the options. So yeah, things, and it will also give us the latest. Something has been published 2 days ago, it can give us that. So that would be interesting. Yeah.
Right. So artificial intelligence plays role in both diagnosing and treating. Okay. So my next question to you is, what is the potential of gene therapy in cancer treatment?
So, gene therapy has been the fascination of scientists and doctors for a long time. And they tried it and it failed miserably. It's been going around for the last 30 years. But today, there are novel techniques where something known as CRISPR is come in vogue, and I think it is still an experimental. In leukemias, in certain type of leukemia, there is a single point mutation or a genetic defect. Maybe we can correct the gene and get rid of the cancer. Uh, Studies are going on, and I'm sure that there will be a dramatic change in the way we treat cancer thanks to technologies like CRISPR. Yeah.
All right. So my next question to you is, where do you see cancer treatment in the next 5 to 10 years?
Problem is, say our country, India, we have a huge population, and 50 to 60% of the population in the next 10 to 15 years is going to enter the era of where they will need hospitalization or some form of medical treatment for non-communicable disease. So when I say non-communicable disease, it means diabetes, blood pressure, arthritis, or cancer. So a lot of these things are going to happen. Cataracts, so many things. This sort of treatment is going to be needed by people. Cardiac. So when we look at all the non-communicable disease and the population of our country, I'm worried whether we have enough facilities for that. So it is going to be a huge explosion of cancer in our country. Huge. And I'm sure this data is available with most of the private investors and the government. That is why the government is taking steps to start probably chemo centers and cancer centers across the country. Tata has started so many centers, and every private setup would like to start cancer centers everywhere. Such is the demand and the need for treatment. Now, our country is going to get a huge volume of cancer, so I'm sure that uh, everybody is going to be, it's going to be bad. One. At the same time, I see technology getting used in a very, very different manner. It is not cheap. So the challenge would be to make the technology cheap. A lot of surgeries in the form of minimal invasive, robotic, organ saving surgeries, like, no more radical surgeries, organ saving, high end radiation, proton therapy, photons, gene therapy, targeted, more and more genes to be discovered, more and more targeted drugs to be made. So I think it's going to be a very, very interesting field, especially in the next 10 years, because of the volume of work which has been generated, and the volume of research which is happening across the world. This is going to be a challenge, and this is a challenge that we hope to, we are taking up that huge challenge and responsibility, and we hope that we can deliver well. Thank you.
All right. And my last question to you is, what message would you like to give to those currently undergoing cancer treatment or to those at risk of developing cancer regarding the advancement we are seeing in treatment?
Look, there are two different things. There is a huge segment of patients who are undergoing treatment. I just want you to understand that please do not go for any form of alternative therapy. It does not work. Number one, you are right now in the best of hands in cancer centers where everybody is trying to treat you in the best way possible. The other important fact is, you need, please understand that there may be a challenge when it comes to uh, uh, mobilizing funds, and I'm sure if you reach out to organizations and charitable trusts which are ready to help you, government is ready to help you in some sort of funding. uh, but the more important thing is that don't lose hope. uh, uh, the things in cancer treatment are changing. There's a lot of work being done, and I'm sure that we will come up with better medicines and better treatment than what is currently already there to take on this challenge. Those people, and on the other hand, those people who are high risk for cancer, I can only tell you one thing, that start exercising, maintain a good health, sleep well, be fit, take care of your lungs, do breathing exercises, do small jogging, be fit, so that even if you get cancer, you are ready, your body is ready to take up the challenge of the treatment. Thank
Thank you so much, sir, for your time and for joining with us today. Thank you.
I hope it was worth the wait.
Definitely, sir, definitely. Thank you so much.